Thank you so much. Pat, that was just a brilliant testimony to how well you've led the project. And it was just so exciting, wasn't it?
Yeah.
I think for each of those projects, then there was a real wow moment, wasn't there? You know, it's a fantastic data, brilliant graphs, wonderful conclusions, hitting objectives, and some of those summary slides, you know, just that kind of vision of the future is really, really sort of spine-tinglingly exciting. So thank you so much to all 4 teams, and thank you, Pat. That was just wonderful. So I'm just going to wrap us up now before handing back to Finbar for his closing comments. So I'm just thinking about what these successful projects mean for you, what they mean for Open UK, and what they mean for the people who hold the purse strings. So the first thing that I just want to say is that when we're putting together the EQIP project, a lot of people were asking us, you know, what is an epilepsy team? Who counts? You know, what do we bring together here? So for everybody who's listening today, just have a think about what your epilepsy team is. Our advisory group told us that an epilepsy team needs to have a clear purpose, shared objectives, plan for action, and have defined roles and responsibilities. You can do that, and in fact, we all should do. In terms of ways of working, we talked about having regular structured team meetings. Now, I have an epilepsy team, and we have regular structured team meetings with an agenda and somebody taking minutes, and that's so crucial. Now, you can do that. Lots of places haven't done that yet, but actually, it's something that we should all be doing. And then, lastly, what the advisory group suggested was that teams should have the knowledge and skills to identify priority areas to address, to plan interventions, to engage stakeholders, and to measure success. And that's what the EQIP project has delivered here. So for those teams who have gone through that training, then they have absolutely achieved all of those goals. And I think that that's so important for epilepsy teams up and down the country. So in order for everyone to benefit from such an exciting program delivering such incredible results, then what we would like to see is we would like to see this program rolled out across the nation. And this is a call to arms for all the kind of UK departments of health, the health boards, the ministers, and I'm talking to you, NHS England. So how are you going to support and resource the existing clinical networks? And how are you going to stand by your long-term plan commitments? That's what we want to see. So in Open UK, we stand ready to support the wider rollout of EQIP type activity. And you can change the name of it. We don't mind, but you know, EQIP works for us. We need adequately resourced quality improvement training for epilepsy teams across the country. It worked for diabetes, and we think it'll work for epilepsy. Such funding might flow through the integrated care systems, it might flow through the existing clinical networks, but we need to know what the kind of governance and accountability will be for such a quality improvement structure, and show me the money. That's what I'm saying. So just to bring us home, I'd like to say a few thanks. I'd like to thank Finbar for hosting today. We live forever in your shadow, and we're really grateful for your time today and amazing insight. I want to thank the Emma and the young people who presented today, and Rachel and Owen are on so many committees that I sit on as well, so they give so much of their time, and we're so grateful for their insight and input. The advisory group members who scoped and developed EQIP have really formed what we have seen today. So they take huge credit for bringing the project to where it, you know, for the success of the project. And I'm really grateful for the faculty who facilitated and supported the delivery of the training. And we can't move past Pat, whose kind of incredible wealth of knowledge and training expertise has really helped to bring the project, to drive the project to where it is today. And, you know, you've provided such support to all of those teams. So, Pat, we're really incredibly grateful. You know, I'd love to get you a bigger gig. To those teams who applied and weren't successful, we'd love you to apply when we get our second wave, he said, assuming that there will be one. And for those teams who were selected, you were absolutely fantastic on the residential weekend. You've all delivered amazing projects, and genuinely, we are so proud. I think that the team at Epilepsy 12 have done an amazing job delivering this. I want to thank Megan Peng, I want to thank Katia, I want to thank Emma Hosking, and the Leviathans, Mel and Calvin and Helen and Simon, all of whom have put in so much time and effort, and ultimately have also delivered today's conference. So a huge thanks to you. None of this happens without you. The last thank you is to my Machiavellian overlord, Colin Dunkley, who in this outfit is the brains behind the operation, and everything that is good that is happening in children's epilepsy in this country was thought by Colin first. So Colin he's thought 8 moves ahead in this amazing chess game that we're playing, and we should all be very grateful that we've got a Colin on board. On that bombshell, we'd love to hear what you think about how quality improvement training could be rolled out across the country, and I'd like to hand back to Finbar. Thank you.